Okay, let's unpack this. We received a really fascinating stack of sources focused on respiratory syncytial virus, RSV.
Right.
And it wasn't just data. The sources actually framed this as a kind of 5-minute identification challenge.
A challenge. Interesting.
Yeah, like a test to see how quickly you can spot RSV versus just a run-of-the-mill cold. And that speed aspect, it really highlights how crucial knowing the signs early actually is.
Absolutely. Time is often critical with respiratory viruses.
Exactly. Now, before we dive deeper into those symptoms that kind of hide in plain sight, we did want to mention something important. For critical health insights like this deep dive, you should definitely visit Mind Expansion Daily. You'll get great information just like this over there.
Good point.
And please like and subscribe to Mind Expansion Daily to join our community. We'd love to have you. Also, if this content grabs you, if you appreciate the information we're sharing, you can support us by buying us a coffee. The link for that is right there in the description.
A little caffeine always helps the deep dives.
It certainly does. And one more thing, we challenge you to leave a comment below. Let us know. Do you agree or disagree with our summary of RSV? Oh, and finally, please list the location you're tuning in from. We really want to increase our reach worldwide and hear from everyone.
Yeah, that would be great to see.
Okay, so back to the mission. Why this 5-minute challenge idea matters so much. The core goal today, it's simple, but it's vital. We need to quickly identify the key symptoms of RSV, understand why it gets mistaken for a common cold so often, that huge 40% misdiagnosis rate we found, and really grasp the high stakes, especially for high-risk groups. Think of this as your critical shortcut to getting properly informed about a virus that affects, 64 million people globally every year?
That's right. And what's fascinating here, or maybe sobering, is realizing RSV isn't just some seasonal bug. It's practically a global health issue hiding in plain sight.
64 million infections.
And according to the WHO, a staggering 160,000 deaths worldwide every single year.
Bye.
And if you bring that closer to home, just in the U.S., the CDC reports 2.1 million outpatient visits
2.1 million.
and 80,000 hospitalizations annually. Mostly, concentrated among the very young kids under 5 and older adults, say, over 65.
That's an incredible volume of cases. We hear about RSV, but those numbers really put it in a different category, almost like a hidden epidemic.
Exactly. And the reason it stays sort of hidden is that detection lag you mentioned.
The 40%?
Yes. The sources kept emphasizing that the symptoms mimic a standard cold so closely that diagnosis gets delayed in 40% of cases. Think about that. 4 people walk into a clinic in winter with what looks like a bad cold. Statistically, almost 2 of them might actually have RSV, but it won't be picked up quickly enough.
That 40% misdiagnosis figure is huge. And it leads straight to the so what question, doesn't it? Why is speed so critical? If the sources frame it as a 5-minute challenge, what difference do those early hours make?
Well, because early intervention, it translates directly into massive, really tangible benefits, both medically and financially.
Okay.
The data we saw from 2024 was pretty compelling. Aggressive early action, specifically focused on just spotting it early, it cut U.S. hospitalizations by 20%.
20%? That's significant.
It is. And that resulted in an estimated saving of about $1.2 billion. Billion with a B.
Wow. And how does that work? What's the mechanism?
It comes down to treatment timing. Antiviral treatments, or often just high-level supportive care like oxygen, they have to be started within about 48 hours of symptoms kicking in to be most effective.
48 hours? That's not long.
Not at all. But doing that, getting treatment in that window, it reduces the risk of severe complications by around 30%.
And if you miss that window?
Then the risk goes up. About 10% of cases progress to severe complications, things like pneumonia. That 48-hour window is basically everything.
It sounds like so much depends on the patient, or maybe the parent, noticing those key warning signs before they even get to a doctor. If speed is paramount, like the data shows, let's look at that 5-minute challenge. What are we supposed to spot? How do we cut through that cold camouflage?
Right. This is where we need to look beyond just, general sniffles and focus on a specific cluster of symptoms that appear really frequently.
A cluster. Okay.
What's kind of unique about RSV, or at least very common, is that 90% of cases start with the most innocent sign possible. Just a simple runny nose.
90%. So nearly everyone.
Pretty much. That's often quickly followed by a persistent cough. That hits about 80% of patients. But it's really the next symptom that should ring the alarm bells.
Okay, which one is that?
Wheezing. That distinct whistling sound when someone breathes.
Right, I know that sound.
It's caused by inflammation in the small airways of the lungs. and it's present in 50% of all RSV cases. It's especially noticeable in young children whose airways are just so tiny and easily blocked.
So a regular cold doesn't usually cause wheezing that often or that severely?
Generally, no, not with that kind of frequency. So when you combine that persistent cough, the 80%, with the wheezing, the 50%, that's your critical sign that this might be more than just a cold.
Okay, cough plus wheezing. Got it. What about the rest of the signs in that cluster? The less obvious ones, maybe behavioral.
Well, that's where it gets tricky, and probably why we see that 40% misdiagnosis rate. The symptoms become quite age-specific.
Ah, okay.
So for infants, for example, you often see irritability, just general fussiness or distress. That shows up in about 60% of infant cases.
60%, that's a lot.
It is. And they often also suffer a loss of appetite, which affects about 50%, often because, they're struggling to coordinate breathing and feeding at the same time.
That must be terrifying for parents, the inability to feed and the constant fussiness.
Oh, absolutely. And adding to that, those same infants might also start vomiting. That hits about 20%, and it's often because they're swallowing so much mucus. Then, sort of across all age groups, you see general difficulty breathing, labored breathing. That impacts about 40%, and it's particularly pronounced in those who are already in high-risk categories.
Right. Now, the source material mentioned two key symptoms that people doing this identification challenge frequently miss, which really shows how sneaky this virus can be.
Yes, and this is where the presentation in adults really muddies the waters. People missed fever.
Fever. But isn't that common with colds, too?
It is, but with RSV, while it's present in maybe 40% of cases, it's often low grade. So people tend to dismiss it, thinking it's just minor flu or a slight cold.
Okay, makes sense. What was the other one?
The other missed symptom was chest pain. This is present in about 20% of cases, but it's far more common in older adults than it is in children.
Ah, so an adult might feel that, but a child wouldn't necessarily complain about it.
Exactly. So picture an otherwise healthy adult. They get a bit of a cough, maybe feel some mild chest discomfort, a low fever. They just think, oh, it's the usual winter crud.
Yeah, happens all the time.
They're suffering from what we might call cold bias, right? They assume the most common illness, and that masks the underlying RSV. That difference, infants showing 60% irritability, adults maybe showing 20% chest pain, that's a big part of why that 40% misdiagnosis happens.
So if the symptoms are so deceptive and they vary so much by age, who is most vulnerable when these diagnoses get delayed past that crucial 48-hour window? Who really needs to worry most?
Yeah, that's a really important question. It tells us where our focus needs to be. The sources, drawing on CDC and American Lung Association data, they paint a clear picture. Infants under 1 year old, they are sadly right at the epicenter.
Under one.
They account for a massive 70% of all RSV hospitalizations. 70%. Partly it's just physiology. Their tiny, still developing airways are incredibly susceptible to that inflammation we talked about.
70% is just huge. And what about the other end of the age spectrum? Older adults?
Yes, older adults, those 65 and up, they face a really significant mortality risk. The estimates are between 14,000 and 24,000 deaths every year in the U.S. alone from RSV.
14 to 24,000 deaths.
Yeah.
Just from this one virus.
It's a major threat to that age group. But risk isn't just about age. It's made worse by pre-existing conditions.
Like what?
Well, premature infants, for instance. Their lungs are underdeveloped, so they have a 3 times higher risk of getting severely ill from RSV compared to full-term babies.
3 times higher.
And for anyone, child or adult, with chronic heart or lung conditions, think asthma, COPD, congenital heart disease, and RSV infection, increases the severity risk by a significant 30%.
Okay, here's where it gets really interesting, or perhaps alarming. Connecting these high-risk groups to the actual complications that happen when treatment is delayed. What happens when RSV progresses past that 48-hour mark in these vulnerable people?
Well, the complications are serious, and they really target the respiratory system, as you'd expect. Pneumonia is a big one. It affects about 10% of overall cases when things get severe. That's a major, potentially life-threatening progression.
10% develop pneumonia.
And we also see bronchiolitis quite often, especially in infants. That's the painful, dangerous swelling of those small airways, the bronchioles. That hits about 20% of infants with severe RSV.
Bronchiolitis, right.
And for those who already have conditions like asthma or COPD, a delayed diagnosis, letting RSV run unchecked, means their existing chronic conditions get worse in about 15% of cases, often bad enough to require intensive care.
So it Exacerbates underlying problems.
Significantly.
Yeah.
And the source material specifically noted that missing that 48-hour treatment window increases the risk of developing pneumonia by 25%, specifically in these high-risk populations.
25% higher risk of pneumonia just from a delay. That really underscores the life-saving relevance of spotting it early. Reminds me of that powerful anecdote we saw about the 2-year-old.
Ah, yes, that was a great example.
His parents initially saw just a runny nose and cough, classic cold bias, right?
Yeah.
But because they recognized those secondary age-specific red flags, the distinct wheezing sound starting up and the unusually high levels of irritability, they sought medical help immediately.
Right, it didn't wait.
And that swift action led to an RSV diagnosis, getting him oxygen therapy right away, which very likely prevented it from progressing to serious pneumonia.
That case perfectly illustrates the power of recognizing the cluster. You don't need a lab test right at home. You just need to spot the pattern, the cough, plus the wheezing, or maybe the irritability plus the difficulty breathing, and then act fast. Don't dismiss it.
So, zooming out from individual cases, what does this increased awareness mean for the bigger picture? We're talking about significant public health implications, aren't we? And cost savings, too.
Oh, absolutely. The power of awareness campaigns, simply educating the public, parents, caregivers, even healthcare providers about these 7 key symptoms. It's undeniable. It creates a positive domino effect.
How so?
Well, in 2024, for instance, the heightened awareness around RSV actually boosted vaccination rates by 25% among eligible groups.
25% increase in vaccinations just from awareness.
Exactly. And that same push for early detection, particularly in pediatric clinics, it cut overall pediatric hospitalizations from RSV by 15%.
15% fewer kids in the hospital.
Which, when you translate that into costs, saved an estimated $800 million in healthcare spending in just one season. So the savings aren't just theoretical, they are real. And they happen because of simple knowledge getting out there.
And looking ahead, the projected impact seems even larger if we can keep driving down that 40% misdiagnosis rate.
It is. McKinsey did a projection, and they estimate that by continuing to raise public awareness, by making sure more people can successfully pass that metaphorical 5-minute identification challenge, we could potentially prevent 25% of all RSV complications.
A quarter of all complications
Yep.
prevented.
And when you look at the total burden RSV places on the healthcare system, preventing those complications translates to saving potentially $5 billion by the year 2030.
$5 billion. That's the economic power of just preventing that 10% risk of severe progression we talked about.
Precisely. It shows the immense value locked up in early, accurate diagnosis.
And it's not just about passively recognizing symptoms, is it? We also have proactive protective measures now. The source has highlighted the crucial role of vaccines.
Definitely. Vaccines like RSV PREF3, particularly for seniors, have shown real promise. Data indicates they cut severe RSV cases in that older adult group by a very significant 40%.
40% reduction in severe cases for seniors. That's huge.
It is. So the overall message seems clear. Knowing the threat exists, understanding how it presents, that's the very first essential step toward neutralizing its impact.
So our final takeaway, pulling it all together from the source material, it feels quite powerful, but also quite simple. Just knowing those 7 key symptoms, the runny nose, the persistent cough, the wheezing, difficulty breathing, irritability, loss of appetite, and sometimes vomiting, just knowing those covers about 80% of cases.
80%, yeah.
Which really proves that this basic knowledge is the direct path to taking swift action and, crucially, avoiding that dangerous 48-hour delay.
Yeah, if we connect all this back to the bigger picture, I think the key insight is that RSV's primary danger really lies in its camouflage. It acts like, a wolf in sheep's clothing, medically speaking.
Good analogy.
Recognizing those high-frequency symptoms, the 90% runny nose, the 80% cough, but then critically combining them with those age-specific red flags we discussed.
Like the irritability in babies or the chest pain in adults.
Exactly. Whether it's the 60% irritability in infants or the 20% chest pain in adults, spotting that combination is the immediate path to preventing that serious 10% risk of progression to pneumonia or bronchiolitis. It's such a common virus, but it really demands uncommon vigilance from all of us.
And despite those huge numbers, 2.1 million U.S. outpatient visits every year, misdiagnosis still impacts a massive 40% of cases. 40%.
Still far too high.
So given all this information, here's something to think about. What previously mild cold or sniffle, maybe one you had last year or one you might encounter this coming cold season, which usually runs October through March, might you now approach with a bit more critical awareness?
Good question.
Knowing that wheezing sound in a child or maybe unexplained chest pain in an older relative could potentially be the difference between dismissing it as a cold and catching a potentially life-threatening infection early. What's the most important behavioral change you might make based on this?
It definitely makes you think differently about those symptoms.
It does. We really encourage you to keep exploring the prevention tactics mentioned in the sources, like vaccination and good hygiene. And of course, visit Mind Expansion Daily for more deep dives like this one.